Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Accelerated Health with Sara Banta. I'm a busy wife, mom of 3, and an NANP certified supplement professional, but that's not all. I'm also the founder of the multi-award-winning Accelerated Health Products, a brand offering innovative, natural, scalar-enhanced supplements to optimize your health. And this podcast is not just a source of information, it's a community. We're all here to learn and grow on our health journeys, and this is the springboard to learning, and the free group coaching is where we continue learning together. You ask your questions. I post tips and tools every day to deepen your health and to keep you motivated to move forward. That's the whole goal, not to drop off like a cliff after day 1, right? So here's what you can expect. New episodes every Monday and Wednesday with in-depth health discussions and expert guests, hot topic issues that are in the news every Friday, and the free group coaching, of course, to continue asking questions, learning on a daily basis. And the details can be found on my website at SaraBantaHealth.com. Have you thought about detoxing, but you're a little nervous, those detox flu symptoms? Well, I've created over 10 unique, easy detox cleanse programs to help reset your body while feeling great, just from getting to go poop and the colon cleanse to parasite cleanses to candida cleanses to the accelerated diet cleanse that includes the liver flush cleanse. You get the stones out and you feel amazing. And if you're not ready for a cleanse, but you do want to start with some supplements, just complete my health goals form and I will put together a free protocol just for you. And I do it personally. So just by taking a few steps forward with your health, you will change your life, and I'm here to help you every step of the way. And today we have a guest that is going to be part of that journey. Welcome to Matt Dawson. He has crystallized the approach of true health care versus sick care, right? And this is precision medicine, servicing a service providing personalized genetic-based care to help patients achieve their optimal well-being. And you can't do that unless you know everything about you inside and out, not just your genetics, but your current state of health. Welcome, Matt. How are you today?
I'm great. Thanks for having me. How are you?
I'm great, and I told you that I was going to tell you a little bit of my experience with your company. They approached me and said, hey, can we do a complimentary DNA test, a full panel, everything, go through our coaching? And I thought, hey, why not, right? There's no downside for more information. I felt good. I'm in the wellness space. I eat clean, organic. I do all the right things. I wear my Oura ring for my sleep. I manage my stress. I do everything you're supposed to do. Well, my blood test came back. My liver enzymes were through the roof. And the ALT was at 700. And there were some other numbers that we were trying to piece together. It truly is a God thing, because within 2 weeks of that, we launched our accelerated liver care. I also put into place some other things about what I knew that could be hindering my liver. One was it was a viral exposure, but then I also was doing some supplements, not accelerated health products, but some other supplements that were actually making things worse and burdening my liver. And this is just a humbling moment where all supplements are not great out there, you guys. They're full of things that we just don't know, and we can't take the company's word for the fact that it's good for us. And it might be good for you, but not me. And that's where we want to get into individual medicine and in an individual approach. So fast forward to now, I did a second blood test through your company. And mind you, also got the DNA feedback, and my liver enzymes are way down. So with that being said, and we can touch more onto my story as we go through, it really sheds light on what is missing in Western medicine. They're not giving that attention. They're not looking at the DNA. They're not looking at how different numbers on the blood test could be indicating a missing link, that it's not, like for me, it wasn't just liver enzymes. There were some other numbers in there that kind of, clued in that there was something else going on. So that's where I really want to dive into what your company's doing, where you found your passion for this, and why the medical world is moving into this realm of precision medicine.
Yeah. Great question, Sarah. So you asked about kind of my passion for this. So it's probably helpful to kind of go back to the beginning. So I'm a physician. I was practicing traditional medicine. And around 6 years ago, I started to become very disillusioned with medicine because people just weren't getting better. And around that time, I also started seeing all this science emerging around precision medicine and genomics. And it looked to me like for the first time, we truly could personalize every treatment down to the level of someone's DNA, not just which medications may or may not work for them, but also supplements and what diet, exercise, sleep. We could personalize everything. So the co-founder of Wild Health and I, Mike Mallon, we dove in, we sequenced our own genetics. And around that time, he had a really difficult medical issue that came up as well. He found that his lipids were through the roof, like really dangerous levels. So he saw his doctor. His doctor told him to do a specific diet that works for most people, but Mike's not most people. He got worse. He's Mike. He's an individual. His doctor then wanted to start him on a statin, which it works for most people, but again, Mike had really bad muscle breakdown myopathy, didn't tolerate it at all, really difficult course. And as he's going through this, we looked at his genetics and we saw that, wow, he has all these specific sensitivities around food that make him probably need the exact opposite diet of what his doctor had put him on. And he had a very specific gene that made him almost guaranteed to get that muscle breakdown and myopathy from the statin. And we were really kind of angry at first, like, why did he have to go through this? And then we realized, oh yeah, even though the science is here, no one is practicing this way. Like, we're not putting it into practice. So we left our university positions, started doing this for friends and family. I saw my mother is one of our first patients. I looked at her genetics. My grandmother had just passed away from dementia. And sure enough, my mother had an ApoE4 gene, which makes her about three times more likely to get dementia. And she had insulin resistance, was obese. And so we put her on the program. We sequenced her DNA, did a ton of blood work, looking at all the things that make you feel and perform a certain way now, collected all kinds of other information, took all of these data points, developed a personalized plan for her when it came to food, exercise, sleep, supplements. And in 3 months, she lost 40 pounds, reversed her insulin resistance, and said she felt 20 years younger. Mike, we put his mother on the program. She lost 80 pounds, got off all of her chronic medications. And since then, we've seen thousands of patients, and we've published on our results, and we get similar results. Like when you personalize down to the level of the DNA, people do really well.
Yeah, and something that I was doing that was making things worse was I was eating a lot of wild animal protein, which is fantastic. However, it was a lot of the bison, the elk, the deer that had a lot of it was red meat. Eating it in moderation is great. Eating it in the quantities I was eating it was raising my iron and raising the burden on my liver. And what I found out, not just from my current blood test through your program, was from my DNA that I needed to tend to more vegetables, fiber. I needed more fiber in my diet, and I needed more fish. And I have a hard time digesting saturated fats. The other insights to my genes that was really interesting is anyone who knows me knows that I need my sauna every single day. Mm-hmm. Every single day. My husband, he uses it, but he's fine without it. I was told that I have a hard time producing heat shock proteins. And the prescription literally said, use infrared sauna, which was eye-opening. The other thing that was really interesting is that I have no ability to break down BCAAs. So if I were going out to take a supplement of BCAAs, it would have only made me worse and it wouldn't have worked, right? Couple other things, like you mentioned, like your family member, I have the ApoE gene. And I went to my 82-year-old set of parents and I said, not that you guys are going to change anything about what you're doing, but I have 3 siblings and we probably want to know more about your genetics that you're passing down to us, because now I know that one of you gave me this gene, and you better believe that I'm doing everything in my power to prevent that. And I wouldn't have known that from my blood test or from the way my brain feels, because I feel good. But it's those little things that, okay, so that's not a death sentence. That doesn't mean I'm absolutely going to get it. It means that I now can take control over the predisposition at the age of 48 and prevent this from happening. And it's not just about dementia, it's about any chronic disease, cancers, you name it, correct? And I'm sure you're seeing so many people shift their lifestyle with the hopes of prevention, but then you're also getting these other benefits, like the people that you mentioned, the weight loss that just came with it, which getting off the medication. And what about the side effects of the medications that they had been on that we're not even talking about? So it's almost like this domino effect and giving people control back. So what is the biggest aha from looking at health from this comprehensive view?
Yeah, I think the biggest aha is that everything can be personalized. Like traditional medicine treats it, it's a one size fits all thing, or we're making recommendation based on statistic, like what works for most people. But everything you talk about can be personalized. When it comes to diet, it was very interesting. Mike and I, we looked at our genetics. It looked like we needed to be on potentially exact opposite diets. Like he had all these sensitivities to saturated fats and things where it looked like he needed to be almost on a vegan diet, whereas I had none of those. And I could eat as much saturated fat as I wanted. It looked like I need to be on probably more like a ketogenic diet with all these sensitivities to carbohydrates. So we did an interesting experiment where we would eat each other's diet. So we would eat the same thing for several weeks. We would eat his diet for a few weeks. We would check our blood before and after. We'd do the same workouts during it, and eat the exact same meals. And when we were eating his diet, he felt amazing. He crushed me in the workouts, and my blood work looked horrible. His was good. Then when we switched to my diet for a few weeks, I beat him in the workouts. My blood work looked great. I felt great, and he felt like crap. And it was such an aha moment for us. Like, this is why diets are like religious wars, people arguing, because they'll find the one that works for themselves, and they think that's the perfect human diet, and it's not. We're so individualized, and it's not just diet; it's exercise. There's lots of studies showing athletes who train based on their genetics have better performance. They make better gains. For me, I saw that at the time when I first looked at my genetics, I was doing Ironman racing, and I saw that I had some genes that meant I needed more recovery than most people. Mm-hmm. So I dialed back the recovery a little bit and performed way better, when really the common wisdom was I needed to be doing a lot of volume, but not for me. I also saw that I had a collagen 5A1 SNP, meaning I needed more collagen protein. And at the time, I had all these tendon and ligament injuries that would always crop up. And once I started eating a lot more collagen protein, those went away. So everything can be personalized. I think that's the biggest aha moment, when people see their genetics and they realize. They also will find things like you found with the sauna, like that you figured it out over time in trial and error. You're like, I have to have my sauna. Well, now you know why. Right. But if we can shortcut that and give people the personalized information about themselves early, so they don't have to go through all the trial and error and the suffering, that's what we want to do.
Right. And there were some other aha moments. I'm trying to think, because of with the exercise, as you just mentioned, I am supposed to lift heavy weights. Like that is the type of exercise that I am prone to, but I also need 1 to 2 days of recovery, which is really hard for me because I love going in the gym, but I've now incorporated some yoga once to twice a week to mix it up, and I'm still getting that output that I'm feeling. And it's really amazing because I'm actually seeing gains when I wasn't thinking that I was doing more with lifting heavy weights every single day. So we're all trying to anti-age. The whole goal here is to live optimally till the end. So let's talk about what is aging, chronological versus biological age, and does it even mean anything?
Yeah. So chronological age, that's easy. Most people know how many birthdays they've had. That's their chronological age. That's not what is important, though. Biological age is what matters. We all know 80-year-olds that look and perform like they're 60, or 40-year-olds that look and perform like they're 60. So biological age is the number one risk factor for every chronic disease. It's interesting. If you look at what increases our risk for cancer and heart attack, all of these things, we know smoking, obesity, these things do, but they pale in comparison to age. So if there's a way to actually decrease your biological age or slow down your rate of aging, we should do that. We actually take a very serious approach to that, and we actually measure biological age and pace of aging through epigenetic testing, through DNA methylation and epigenetic testing. And that way, you can't really dial something in and make an improvement on it if you're not measuring it, if you don't have an objective measure. So, for example, we use something called the PACE test. This was developed by Duke, and it tells your rate of aging. So it gives you a score from like 0.6 to 1.4 on how fast you're aging. 1.0 is average. And the cool thing about this test is it's very sensitive to intervention and change. So, for example, if you get pregnant, which is a physiologic stress, your rate of aging goes up about 20%, but then it comes back down when you deliver. Mm-hmm. Or if you get COVID or get in a car accident or have hip surgery, your rate of aging goes up and it comes back down when you recover. So what this means is it allows us to do these N-of-1 experiments with patients to see what reduces their rate of aging. So Stanford did this study where they switched people back and forth between omnivore and vegan diets and looked at their pace of aging. And you could see changes in pace of aging in those 8 weeks. So you could, if someone wants to do a carnivore diet or wants to do a vegan diet or wants to do a keto diet, you could do this pace of aging test and then repeat it after 8 weeks and see how it's affected your rate of aging. Or if someone wants to do whole body IV stem cells or try some new supplement regimens or try rapamycin or some other longevity compound, they can do this test before and after and get an objective measure. And if you do these experiments kind of a quarter at a time every few months, you can slowly dial in the things that most optimize your rate of aging, which is the goal. And we frequently will see people take the rate of aging down 10% or even sometimes up to 20%. And if you reduce your rate of aging by 20% over the next 50 years, you've added 10 years to your health span. So that's a tremendous benefit. So we really try to dial in that rate of aging and have an objective measure for it.
It just makes sense, right? And you hear people out there say, well, we can live till 150 now. Not that we want to in this chaotic world, but having that quality of life later in life. And, I look at some grandparents in my family that are bedridden, and then I will be out on a hike in Idaho and I'll have these 80-year-olds pass me because they're so fit. So which one do you want? And it's what we're doing today that is going to affect our later years. The report that you give through Wild Health, I've done DNA reports. I've done programs like what you offer. The detail and the expertise behind it with your doctors was top notch. It blew away the other ones. My DNA was the same. So we're comparing apples to apples. And what they told me that I should be doing according to my DNA was very elementary. Anyone would have been able to tell me to not eat fried foods and, incorporate more fruits and vegetables. But what they were telling me also was, eat these foods. And I know personally that those foods don't work for me. Whereas your program and the thick document of the report that I got from me was so comprehensive. So why don't we go through what is incorporated in that document and that report where you're incorporating your biological age, your DNA, and then your current state of health with your blood tests.
Mm-hmm. Yeah, it's very robust. It's a holistic view. That's the difference. So even though we're a genomics-based precision medicine company, DNA by itself, in my mind, is almost useless. Like I have to know about, and because our DNA is not our destiny. DNA is important, it accounts for about 20% of our health outcome. But the other 80% are epigenetics, and it's about what we do, what we eat, how we sleep, what we're exposed to, our stress levels. So we want to measure that DNA, your operating system. We have to know that. We also have to know how are you doing right now, all of your blood work right now, all the vitamins, minerals, nutrients, the things that make you feel and perform a certain way. And we need to talk to you. We need to get phenotypic data and find out more about you that we can't measure objectively. And we want to do the epigenetic testing. So the biological age test, we look at about 1 million different genes and how much each one is being expressed or not just what are the genes, but how much are you expressing those genes. So we pull in millions of data points. We spent $50 million plus on this platform, this AI platform, to make the recommendations. But it takes all of that into account to then make a recommendation of what is the perfect food for you. Like for my mother, she had a VDR SNP, meaning genetically she probably needed more vitamin D, but then we want to measure what is her vitamin D level. She had a FADS2 polymorphism, meaning she needed more omega-3, collagen 5A1 for more collagen, BCMO for more vitamin A. You add all of these up, and the AI can then say, okay, the world's perfect food for her is a sardine, a little whole sardine. And then when it comes to kryptonite foods, she had an SH2B3, so wheat is going to be very inflammatory, and MCM6, so dairy is going to be very inflammatory. But then we also need to talk to her about what is she going to eat and look at her blood levels and things and pull all of that information in to be able to come up with the perfect diet and the perfect exercise plan and the perfect supplements. You have to take it all into account. And that's what we've tried to do, take a very holistic view of someone.
And when you give someone like your mom this report and this information, she's not me. She's not into health. She doesn't love, diving into all of this information. How do you help her not be overwhelmed with all this information and incorporate these new steps, step by step?
Yeah. It's every single patient gets a doctor and a health coach to help them navigate this. So that's the first thing. You're not doing this on your own. We don't just deliver a report and say, good luck. We also talk to the patient and figure out what is most important to them so we can focus in, because there's going to be a lot that we could work on. So we talk and figure out what is your goal. And then we look, and based on the biggest risk factors or the biggest things we find, we say, these are the most important things. And we'll usually go with 1 or 2 goals at a time to focus on. What are the biggest leverage things? So it's a big report, but we really do try to simplify down to what are we going to do right now that's going to most help you reach your goal, whatever it is. And then we're there. We also then talk about when we're going to do repeat testing to make sure that we're making the progress. And the health coach is always there to have calls and to communicate and message with and help figure things out as you run into things. Like we talk about perfect foods and things, but then you maybe out to eat. What are you going to eat when you're out to eat or something? And so we're always there educating and teaching as well, and holding the hand of the patient.
And as we're talking about how your program helps people move forward, anti-age, reverse that biological age, I just want to touch on the trap of Western medicine with the medications, because we know that insulin resistance is through the roof, and that is what feeds the heart disease, feeds the infertility, feeds fatty liver disease, diabetes, Alzheimer's, dementia. We're in a world where 70% of the food supply is processed foods. We've got these microplastics and these toxins and the fluoride in the water. All of these things are coming down on us, and we assume that food and water and air are good for us regardless. That's what the typical American will think. And then if I don't feel good, I go to my doctor. My doctor gives me a medication, and then there's this domino effect of, okay, that fixed my stuffy nose, but now I'm depressed or I have these other issues. You go and get on another medication. You've got this cocktail. So can you just talk through this? Because I feel like it's not until people are just under a whole bunch of medication, feel horrible, that then they want to come to you. Whereas maybe they should cut it at the pass and actually come to you first.
Yeah. Yeah, I think Western medicine usually frequently uses medications as a band-aid to cover over a symptom without thinking about the root cause, and that's the wrong approach. You really do need to get to the root cause of what's going on to fix it. A perfect example of that is we had an NBA player who came to us originally because of mood issues. So just feeling really down and depressed throughout the season. And traditional medicine's approach would have been just to put him on an SSRI. We did not do that. We dug into like what's going on, like talking, looking at his lifestyle, looking at his genetics. And it turned out he was doing what all the other players on his team do is like right before a game, drink a bunch of caffeine, Red Bulls and things. And because we've known for decades that caffeine is an ergogenic aid, it makes you perform better athletically. However, when you really look at those studies, what those studies show is like every study, most people a certain thing works for. Well, it turns out like 80% of people benefit and perform better with caffeine. Well, that's because 80% of people are fast metabolizers genetically. But when you break it down genetically, the fast metabolizers perform better with caffeine. Those who genetically are slow metabolizers, it actually hurts their performance. And he was a slow metabolizer. He also genetically had a specific gene that called an Adora 2A that made caffeine have a more negative impact on his sleep than other people. So the fact that he was a slow metabolizer, having it in the evening, he also had this sleep gene, really meant that it destroyed his sleep. He couldn't get to sleep. He would wake up just in time the next day for a shoot around after just falling asleep. Then he'd have to go take a nap, and then this vicious cycle that was destroying his mood. And when we fixed this root cause, when we got him on a supplement plan and lifestyle plan, a sleep plan according that fit to his genetics for him, he got much better. He had a career year. His mood got better. And we fixed the problem instead of putting a Band-Aid on it and putting him on an SSRI and not solving the problem. So medications can be useful if they're a bridge to something to get us somewhere, but not just to cover up a symptom. Like we have to dig into the root cause of things. And 90% of the time we can fix that with lifestyle, with diet, exercise, sleep, these basics. We end up stopping more medications than we start on patients because when you uncover these root causes, people get better. The body wants to be better. We just have to support it in its own bio-individual way.
It's really interesting with me. You go through this whole trendy diet, ketogenic, intermittent fasting, carnivore, and I've been incorporating that or, on the bandwagon over the last couple of years. But I knew for me that a high-fat diet just never worked. I always focused on the protein, but I was promoting the ketogenic diet for most people, where I can't be on a high-fat diet. And in fact, on my report, it said a high-fat diet is going to cause insulin resistance. And what's also very interesting, I don't eat a lot of sugar. My A1C and my glucose is high right now. Well, why? Because my liver was suffering. It wasn't the food. So there's all of these interesting little aspects. Another interesting fact is like far infrared light, red light, super healthy for most people. My daughter, I'm like, you've got to go do red light therapy. And she would feel worse because it was actually her genetics were to the fact where it was actually going to make her feel worse, tired, lightheaded, all the wrong things. But people are told that these things are good for you. And then they do them thinking, well, maybe something's wrong with me. Maybe I should just keep doing more, just like with the caffeine. And maybe that's going to help, right? So it's very interesting. We are all different. Food, exercise, sleep patterns, all of that. And it's just the report really helps with you understanding you, so you feel like you can take more control over yourself. Because I feel like people do want to feel better. They're not low in willpower. They're not binging on foods because they're out of control. They're binging on foods because their body's not getting the nutrients it needs. And so the brain's saying, no, get me more of whatever it is. I want to feel better. So they're reaching for things that are hurting them, but they think that they're supposed to help them. And that's where this individualized program is so much more helpful and gives people that control back. There's that big word stress. And I wanted to know that through your program, how you handle that with people, the impact of stress on the lifespan, what you see, and then how you help your clients lower that stress and get it under control.
Yeah, it's absolutely critical. Stress plays a huge role in all of our risk for disease and aging as well. It really accelerates aging, so it's really critically important. We try to start with all the things we just talked about, like diet, exercise, sleep. Those things, when you dial those in, people just start to realize they're much less stressed. Like if you're talking about stress and you're not addressing sleep and what you're eating and your exercise, you really have to do those things. After we've addressed those big buckets, though, we certainly talk about stress reduction, and we talk about mindfulness and meditation and what to do on an individual level. There's some interesting genetics around this too. For example, there's a gene, the OXTR gene. It's related to oxytocin, and when someone has a specific variant of that, they tend to do better with loving kindness meditation than someone else would. So there's an emerging field around even kind of precision stress reduction and precision therapy. But stress reduction in general is something that is very individualized, like what works for different people. So we take a very individualized approach to that. It's also important just to help people understand how critical it is. The biggest study on health span and happiness, I think the biggest and best, is one that Harvard did, the study of healthy aging, I think is what the title of it was. But it was over 80 years, a large number of patients. They looked at everything and what is the biggest factor that leads to health span and happiness, which it's crazy not to study happiness with health span. We have to. And what they found was really interesting. The biggest factor wasn't diet, wasn't exercise, wasn't smoking. We know smoking takes 10 years off your life, but the impact of this one thing was more important than smoking. And that was the strength of your social relationships. So your connection to others. And when we talk about connection, I talk about it as not just a connection to others, but a connection to yourself and to the food you eat and to nature and to your body. And so we try to help our patients understand that we're going to be doing all of these things to affect your physiology, but your connection with others and how much time you think about that and focus on that is going to make a major impact. So if someone is talking to me about all the latest biohacking things and what to do and what to take and what not to take, and they're not focusing on connection and their social relationships, they're kind of wasting their time. And so we try to remind people about that and what really matters.
And I don't think that's a mystery to people. I think people have seen that during COVID and the isolation that mental health really went down. And obviously physical health did too, because people, were locked inside and got sedentary, and it was one thing after another, and they were making things much worse. I mean, I've got 3 children. It would be hard to find any child that is not suffering from ADHD, anxiety, or depression. It is through the roof. I think there was a statistic that over 90% of college students are suffering from depression or anxiety. And I've seen it in my own children, and my kids eat healthy and they take care of their bodies better than most people. And it's that social connection. But then you've got the cell phones that are really disrupting what it means to be social. Right? You think you've got thousands of friends on Instagram, but really, do you have any friends? Are you seeing someone in person? Are you getting hugs? It's that physical touch. And you mentioned oxytocin, which is such an important hormone. Dopamine, getting the dopamine hits from touch and physical activity and all the things. It's so important. And your doctor's not telling you this. Your doctor is not testing your full thyroid panel to see if your thyroid's low and that's why you're depressed. Your doctor is not asking you, how are your friends at school? What are you getting outside? Are you playing ball? These are things that we took for granted when we were growing up. So it brings to light a lot of these factors that are so important that are missing in traditional medicine. and it's not the doctor's fault. They only have 15 minutes to spend with you. When I was on a call with with Dr. Jeff, we ran out of time, and he said, Sara, I don't want to finish. I don't want to leave you like that. I want to finish this conversation. Can I text you later and we'll just hop on a call for an extra 30 minutes to 60 minutes? He wanted to make sure that I had all the information and that I understood everything in my report and what's going on in my body. And I did not feel rushed. I felt like I was totally understood, which you don't get that. So, question. Outside of the blood tests, outside of the DNA, there's now things on a daily basis that people use, like wearables, like an Oura ring, to kind of track your health, your progress. What is your view of those, and how can someone add that into their regimen to help them on their path?
Yeah, I think they can be incredibly helpful, and we use a lot of them. Like with our patients, frequently we'll recommend an Aura or a Whoop or an Apple Watch or continuous glucose monitors. We use those a lot as well to get data. I will say we occasionally have people where we tell them to stop wearing them because they become kind of obsessive with it, and they're looking at their sleep data, and then they're laying in bed and not getting to sleep, and then they're freaking out because their sleep data is going to be bad the next day, and it makes it worse. And so we try to take a pragmatic approach to them. Is like they're good data, but we need to have a plan of what to do with the data too, so it's actually useful. So, for example, like CGMs, we'll have someone wear those, but maybe like for 2 to 4 weeks to really figure out what foods have an effect on you, how sleep affects your glucose, how stress affects your glucose, how exercise does. And we learn some things and then we incorporate that. Same thing for sleep trackers and exercise trackers. If you're wearing them, it's great to get that kind of biofeedback, but we use them a lot of times to do experiments as well. Like if someone's not sleeping great, well, let's collect the data. Let's see what's going on. Is it a sleep latency issue? Is it deep sleep? Is it REM sleep? Like what's the issue? And then based on that, we can kind of dive into what is the solution, whether it's a timing issue or whether it is a specific supplement or whether it's stress or what is it. And we get clues from the data. So it can be very helpful, but I think you also want to take an organized approach to it to be able to get the most benefit out of your wearables.
Well, I can tell you that it can be cause anxiety. And I wore a CGM for a while, and it was stressful because I was like, oh God, where's my number going to go? And but it was fine, and everything was fine. And same with the Oura Ring. I was listening to someone talk about how much deep sleep you're supposed to have, and I'm like, I don't even get half of that. And so it's one of those things that you do need to approach it with caution. Use it as a tool, but not just be totally obsessed with it. So, yeah.
And with the deep sleep and the REM sleep, you also have to, and your HRV with these, like you also have to understand like all the different devices use different algorithms and stuff too. So sometimes we'll help our patients realize that someone may say on a podcast, you need X amount of a certain type of sleep. Well, that's with the device they're talking about, which may have a slightly different algorithm and things. So it can be stress inducing, and that's good. I think it's good to have a guide, your physician and health coach to help someone who's looking at this in hundreds of patients as well, and they have a breadth of experience and seeing different things.
I appreciate you saying that. That makes me feel better about the amount of deep sleep I'm getting. I'm just going to take it that I'm getting plenty. But it is really interesting the way stress can affect your sleep. And I always tell people, your diet and your exercise and your supplements mean nothing if you're not getting proper sleep. But your supplements, your diet, your stress, and all of those things affect your sleep. So it's very integrated. So before we go, I want to know what you personally have changed in your routine because of your results.
Yeah, great question. So I went over one thing when it comes to exercise and working out. I was doing, like I said, Ironman racing at the time. I really dialed down the volume, and I just found I performed and felt so much better at the time. I'm pretty hard-headed, and I'll just kind of push through pain. And I was just so inflamed and just pushing through because I thought more was better until I got that objective feedback that no, my body actually responds to stress or to exercise with a bigger inflammatory response, which isn't necessarily bad because you want inflammation, you want that hormetic response. You just can't have too much. So seeing that, I dialed that in. My diet as well, the collagen protein made a big difference in seeing that. Also, just individual foods. I mentioned my mother and kind of the perfect food for her. Well, I have very similar genetics to my mother, and I when I really look at everything, like sardines are the perfect food for me. And so every day I have 2 cans of sardines, and it's funny. Like if I haven't had it yet, I can feel my body craving it, and when I take it in, like that nutrient density is so incredible for me. So those are a few things when it comes to kind of diet and exercise that I've changed with my genetics.
Well, I love that you brought up the sardines because Dr. Jeff asked me to ask you how many cans of sardines you can eat in a single setting. So that's, I don't know anyone else that would say that they're eating 2 cans of sardines at once. I'm going to have to try that, see where it goes.
Yeah, it's I feel amazing with. I mean, the omega 3s are very anti-inflammatory. There's so many benefits, and also just when I saw my genetics, like I saw that I don't have really any of these sensitivities to saturated fats and things. So I eat a very kind of animal heavy diet, and my lipids just remain rock solid. Like ApoB super low, like LDLP super low. So yeah, so I definitely eat not a carnivore diet at all, but kind of a pretty heavy keto diet, just seeing how my genetics were set up for that. And I respond really, really well to it.
So this is interesting with my experience. When I got my results, the liver was like screaming. It was saying, give me a break. I need help. And I was told that I needed to lay off the red meat for a little bit, even go a little vegan. And I'm like, I can't go vegan. Are you kidding me? I'm going to lose my muscle. I've worked so hard. I've been taking essential amino acids and weightlifting supplements to build muscle, and I've done it. And now I'm freaking out because it's going to backfire and I'm going to lose everything. Well, the thing to remember is your liver is not assimilating protein in those amino acids if it's not working right. So I was told to eat more white fish for a couple weeks, no amino acid supplements, no weight gaining supplements, actually stop most of the supplements for a couple weeks. I actually put on muscle. So why is that? Because my liver enzymes were coming down. My liver could then actually process the amino acids from the low-fat fish that I was eating. And now I'm able to incorporate some of the amino acids and some of the other stuff because my liver enzymes are close to normal range and probably maybe in normal range by now. I need to get another blood test. But it just shows you that your body is going to use what it wants to, and it's everyone's different. And it's not just your genetics, but it's also your current state of health.
Mm-hmm.
In a month from now, I'm going to be able to eat more red meat. Now, I'm still going to tend to a leaner diet, still incorporating more fiber and white fish than I did before, but I'm able to, optimize my health as I'm healing my liver and things are changing. So I love that you talked about your genetics is really only 20% of the story, because that's so important for people to remember. I have a friend that I think it was 20 years ago. She had a mom with breast cancer. She found out she has the same gene. She got a double mastectomy as preventative. And that is not what you have to do. You can prevent it in different ways. I mean, I've got the gene for Alzheimer's. So what am I going to do about it? I'm not going to eat fried food. I'm going to exercise. I'm going to keep my insulin resistance in check. And I'm going to do all the things that my report essentially said. So it really is an amazing program that you've put together because it gives you that full picture. It gives you control, and you're able to use supplements, diet, and lifestyle hacks to really feel your best. And I feel better today than I've felt when I was young, when in high school or college. So, that's the goal, is to live these healthy, happy lives when we're wiser in our second half of our lives versus our first half. Matt, is there anything before we go that we've missed here today that you want to make sure people know?
No, that's great. Yeah, anyone that's interested in learning more, just go to wildhealth.com and everything is there. But I really appreciate you having me on. It was really fun to hear your story.
Yeah, and I will definitely have a link for a coupon and the link to the website below in the show notes. So make sure you check that out. And this is a company that I definitely recommend. Like I mentioned, I've seen many others. I've experienced what other programs involve and offer, and this is definitely the top. So Matt, thank you and congratulations for creating such an amazing program. So thank you everyone else for joining us and for listening today. Our discussion does not have to stop here. If you're feeling lost in the supplement world, you're getting signs and symptoms and you don't have your DNA done yet, I'm here to help. And I can help you with a free supplement protocol. Just head to SaraBantaHealth.com, complete the form, and I will put one together just for you. Follow me on social media at Accelerated Health Products for more insights, and join the free health group coaching. You'll learn from other people, their symptoms, their reviews, their results. It's a great place to be. You won't feel lonely in this isolating world. And especially for those of us that are on these health journeys, it can be lonely. You can listen anywhere. Find this podcast at Accelerated Health with Sara Banta on Spotify, Apple, iHeartRadio, of course, YouTube, and over 100 different platforms, and spread the knowledge. This podcast especially is so important for everyone to know that there are answers out there besides what your doctor's giving you. You can use coupon podcast10 to get 10% off site-wide as well. Remember, I'm live every Monday, Wednesday, and Friday, so join me next time for more ways to unlock your health potential.